The most common knee injury we see from skiing generally relates to ligamentous injuries about the knee, oftentimes ACL sprains or tears and MCL sprains or tears. These are very common, representing about 20 to 35% of all ski injuries. Here's some strength training exercises that can be done at home to prepare for the ski season. So one of the more beneficial exercises we can do to prevent knee injuries and build up strength is a double leg squat. And when we do this exercise, we're trying to keep our knees centered over our second toe. We're making sure that our knees don't buckle inward. He's doing a nice job of keeping his knees out, and he's focusing on tightening his core. Then this can be modified to a really high skilled exercise, which is a balance board squat. This is great for skiers to practice. Maybe you don't go as deep, maybe you fall off a few times, but it really encourages balance and proprioception. He can also do a double leg squat jump, which he'll demonstrate. The focus here is on a soft landing keeping your knees apart and separated. Another good exercise for knee injury prevention is a crab walk. The focus here is on keeping your knees shoulder width apart, bending at the waist and the hip, and focusing on the glutes and the core. A great exercise for hamstring strength, which is very important in preventing ACL injuries, is a deadlift. Well, this can be done with or without a dumbbell. He's focusing on really contracting his hamstring, keeping his back relatively straight. Another excellent exercise for hamstring strength is a hamstring curl. This can be done in many fashions. Anders is going to demonstrate a double leg curl and a single leg curl. Focus on bridging up first and then pulling your hamstrings or flexing your knees towards you. If you have problems with your low back, you can keep your back against the ground. It just may not be quite as effective. Another great exercise to work on balance and strength is a single leg step over. Anders is now demonstrating a nice slow progression, keeping the knees flexed, shoulder width apart, weight on the balls of his feet. For more advanced folks, and if you don't have an injury that would prevent you, he'll now demonstrate a hop over jump. This is a modified speed skater technique, great for balance. Take your time on each side. Another good exercise to engage the core is a plank. A simple plank can be held for as long as you're comfortable, and then a modification in a more advanced form would be moving the leg out and focusing on your abductors. Other things we should be doing is making sure we're using proper techniques, so it's never a bad idea to get a lesson skiing, snowboarding, and make sure we minimize our risk that way. Our equipment should be properly matched and tuned to our skier level ability. And again, we want to make sure that we are well stretched and basically have good muscle strength to try to prevent injury. Things to be avoided when you think you may have injured your knee are crucial to successful outcomes. And initially, certainly rest, ice, compression, elevation, the traditional RICE treatment is appropriate. But if the knee doesn't respond, or if the knee feels very unstable to a patient, they really should seek evaluation earlier rather than later. And if it's going to take a while to get in to see a physician, we have a Now Care clinic that works wonderfully for drop-in patients who may have recently injured and find it hard with a busy schedule to get in and get a scheduled physician's appointment.